All right, let's dive into one of the most critical skills you will ever learn as a nurse: information technology and, of course, documentation. Seriously, getting this right is absolutely fundamental to your success, not just in clinicals, but on the NCLEX and really through your entire career. So think of this as your deep dive study guide to totally mastering it. Let's get into it. This right here, this quote sets the stage for everything we're about to cover. Your documentation isn't just some chore or paperwork. It is a legal document. Every single word you write, every piece of data you enter, it becomes a permanent part of that patient's legal record. The stakes are incredibly high. So here's our roadmap for this session. We're going to start with the legal foundations of the chart itself, then we'll dive into the principles of what makes documentation great. After that, we'll cover the different formats you'll actually use, tackle the super important topic of HIPAA, and finally, we'll put it all together with some NCLEX prep and a real-world clinical judgment scenario. First up, your legal responsibility. It's so important to understand that the medical record is way more than just a collection of notes. It is the central legal hub for all patient care and communication. Okay, let's really break this definition down. Confidential means you have this massive ethical and legal duty to protect what's inside. Permanent? Well, that means it's forever. And legal document admissible in court means your charting can literally be used as evidence for or against you. And that last part is so key. Only providers directly involved in a patient's care can access it. This isn't a suggestion, it's the law. You know, what's really fascinating is just how many jobs the medical record has. It's not just for us, the healthcare team, to communicate. It's the basis for financial billing, how the hospital gets paid. It's a tool for educating students, a source for vital research, and a key document for auditing and improving the quality of care. And your documentation, it affects every single one of these areas. Okay, so now that we know why this is all so important, let's talk about how to actually do it well. These are the core principles, the how-to guide for creating documentation that's clear, legal, and effective. Mastering these skills is absolutely crucial, both for patient safety and for passing your exams. Here is an awesome memory anchor for the NCLEX. FACTO. Your charting must always be factual, accurate, complete, timely, and organized. Factual means you stick to the data, like the wound is 2 centimeters wide, not the wound looks a little bigger today. Accurate means using precise measurements and only, and I mean only, approved abbreviations. Complete means you don't leave anything important out. If you gave a pain med, you have to chart the patient's response. Timely means you chart right after you provide care, and you never, ever chart before you do something. And finally, organized means you tell the story in a logical way so the next nurse can pick up right where you left off. This slide perfectly illustrates the F in FACTO, being factual. You have got to know the difference between subjective and objective data. Subjective is what the client tells you, their symptoms, their feelings. It's a great idea to use direct quotes whenever you can. Objective, on the other hand, is what you observe and measure, the hard data from your assessment. Great charting always has a mix of both. Okay, pay close attention. Think of this slide as your NCLEX cheat sheet for legal charting. These are the absolute non-negotiable rules. Every single entry needs a date and time. Use black ink and don't leave any blank spaces. If you make a mistake, you have to correct it according to policy, which means no correction fluid, no scribbling it out. And you always sign with your full name and your title. The bottom line here is to just stick to the facts, not your personal opinions. All right, time for a quick knowledge check. Read through these options. Based on what we've just covered, which of these are the correct legal guidelines for documentation? Think it through, because this is exactly the kind of question you're going to see on the NCLEX. Did you get them? The correct answers are B and C. Every entry has to have a date and time, and you must document objective data without throwing in your own opinions. Now let's talk about why the others are wrong. A is a massive no. Never, ever use correction fluid. D is super dangerous. You can only use facility-approved abbreviations. And E, that's a huge pitfall. You have to document in a timely manner, not wait until the end of your shift when all the details get fuzzy. All right, now let's look at the different systems and formats you'll actually be using to document and report on your patients. It's not a one-size-fits-all kind of deal. You need to know which tool to use and when. This table breaks down 3 really common charting methods. You've got SOAP notes, which organize information like a detective solving a case. You move from what the patient says to what you observe, your assessment, and your plan. Then there's PIE charting, which focuses directly on the nursing process. What's the problem? What intervention did you do? And what was the evaluation? And finally, DAR is a focus charting method that really hones in on a specific concern, documenting the data, your action, and the patient's response. This is another huge topic for the NCLEX, and it's all about patient safety. Taking a telephone order is a high-risk activity, so the steps are really rigid. First, if you can, have a second nurse listen in. Second, you repeat the entire order back. Spell out the drug name if you have to. Third, use that amazing clinical judgment you have and question anything that doesn't seem right. And fourth, you have to make sure the provider signs it, usually within 24 hours. Listen up, because this is so important it gets its own slide. Here is the single most important takeaway. You document the facts of what happened, the fall, the medication error, whatever it is, in the patient's chart. But you never, ever write incident report completed in that chart. Why? Because the incident report is an internal quality improvement tool. It is not part of the patient's legal medical record. Mixing those two up is a massive legal mistake. Okay, practice question number 2. Let's put that safety protocol to the test. You're getting a telephone order for morphine. Which of these actions are appropriate? Again, select all that apply. Go ahead and pause and think through those steps we just covered. So the correct answers are A, B, and C. You absolutely have to repeat the details back, have another nurse listen, and make sure the provider signs that order within 24 hours. Those are your required safety checks. D is incorrect because, telephone orders are sometimes necessary, and while telling your charge nurse is probably a good idea, it's not a required step for actually validating the order. Okay, let's talk about a topic that governs absolutely everything we do with patient information, HIPAA. In our digital world, understanding your duty to maintain privacy and confidentiality is more critical than it has ever been. Think of this slide as your daily HIPAA checklist. You can only look at the charts of patients you are assigned to, no curious peeking. Keep your computer locked when you walk away, and please never share your password. Don't talk about patients in the elevator or the cafeteria. Use your facility's code system before giving info to family members, and shred any printed papers. These aren't just good ideas, they're federal law. And now a really quick but really serious word about social media. The rules here are simple and super strict. Just don't post anything about work. Not your facility, not your coworkers, and absolutely not your patients. Taking a picture of a patient, even if you think they can't be identified, can be a career-ending HIPAA violation. Honestly, it's just best to stay off social media completely when you're in a clinical setting. All right, let's bring all of this together now. In this last section, we're going to connect all the dots. From the principles of documentation right to the clinical judgment skills you're going to be tested on for the next generation NCLEX. And this right here is why all of this matters so much. The next-gen NCLEX is all about clinical judgment. And to make good judgments, the very first steps are to recognize cues and analyze cues. And where do those cues come from? They come from excellent assessment and documentation. Your factual, accurate, complete, and timely collection of subjective and objective data. Bad documentation leads to bad clinical judgment. It's as simple as that. Okay, last scenario. Just picture this. You're on a super busy unit, you walk into a room, and you find your patient on the floor. In this moment, everything we've talked about is about to come into play. So what do you do first? And then what's next? This is a classic question of prioritization. I want you to think through the correct sequence of actions based on everything we've covered about assessment, about action, and about documentation. Here are the prioritized actions. First, you assess. Patient safety is always number one. You check for injuries. That's you collecting your objective data. Second, you act. You get them back to bed safely and you call the provider. Third, you document. You chart the event factually in the patient's chart. And fourth, you complete that separate incident report for the facility. This sequence, assess, act, document, report, is the foundation of safe, legal, and effective nursing. If you can master that, you will be well on your way to success.